The way that healthcare is being delivered actually seems to be shifting. We see many healthcare apps that are now being created, Fitbit, Apple Watch. There's just access to data about your own health, and so how that's used by the consumer themselves and then potentially their doctors or even their health insurer, that all can impact how healthcare is being delivered.
Primary care physicians, particularly millennial, the youngest physicians, had the most mixed reactions. I think we thought that the boomer physicians would have that kind of reaction, but it was the millennials who had the most mixed reaction. They think it's going to be positive, but they also think there could be a lot of negatives, just a lot of false positives, inaccurate data, and they want more guidance and more education around that, and I think that's a leading product for any consumer medical device, where patients are going to be walking into primary care and saying, I think I have a problem. We found more of a split generationally around having those conversations with their physicians, and we really heard this a lot in the qualitative. They're fairly comfortable talking about fitness apps and wellness apps with their physician, but they don't expect to talk about medical conditions and apps with their physicians. And the main reason was they don't think their physicians are tech savvy. They guess that maybe younger physicians will be, and maybe that will be a change over time, but most of the consumers we were talking about had older physicians, and they just said they don't really see them as experts around tech. They don't look to them to help them with using their Apple Watch, their Fitbit for their health and medical conditions, even conditions like diabetes.